Listener's note: today's podcast deals with issues of addiction and suicidal ideation. If you or someone you know is having any of these issues, please reach out to 988 Suicide and Crisis Lifeline, or you may text them at 988. Thank you. Hello, everyone. Thank you for joining us for another episode of White Knuckling Through Life. We're happy that you've joined us. If you haven't listened to the last few episodes, we encourage you to do so. We've provided some stories from our own lives. I have Diane Cohen here with me and our special guest who she'll introduce. But if you listen to the last episode, you will appreciate Jake's story as he shared his suffering with addiction and mental health issues and overcoming them through family support and through his own hard work and resources availed to him in his recovery. And having been many years sober now, he's really enjoying his life and looking towards future goals ahead. And so I appreciated that episode and what we gained from it, listening to it, and appreciated his vulnerability. So I'm going to go ahead and turn it over to Diane Cohen, and she's going to give us a little bit of a highlight of what we're going to be talking about today and introduce our guest. Diane.
Yes, hello everyone. So today's topic is really near and dear to my heart. As you know, last week we listened to my son's story, and a lot of it had to do with alcoholism. And, it's very hard to unpack all the stories after, we're trying to squeeze it in half hour, 45 minutes. I'm going to share a little story here real quick about alcohol before I introduce Doctor. And one of the things my husband and I went through with my son was so unbelievable. When it was happening, I couldn't believe it was happening. But then on top of that, in looking back at it, it's almost like you saw it in a movie because it was so surreal. So we were picking up our son. He was drunk. We were trying to get him some treatment. We were taking him to the hospital, called 911, and who patched us through to the hospital emergency. We explained the situation. Our son was angry, suicidal. He was very strong. I mean, my husband and I are both under 5'8". My son is 6'2", at the time, probably over 200 pounds, very, very strong. And we're driving to the hospital and he decides he wants to jump out of the car. He doesn't want any part of this. And literally, I am driving and speaking to the people on the phone saying, this is the situation. I need you to meet me outside of the emergency door. Please be ready. And my husband literally from the front seat is keeping my son in the car as he's trying to jump out in his drunken stupor. And it just was unbelievable what occurred. And alcohol can just destroy so many families. And I'm so grateful that my son found a way to become clean and become sober. However, Leslie, you might remember he said that the 12 steps didn't work for him, although it's really great for some people. There needs alternatives. That is what we have today. Today, our guest is Dr. Amanda Wilson, and she is with the North Star Care. I met Doctor at the Workers' Compensation Disability and it's the National Workers' Compensation Disability Conference. And immediately when I saw her program, I knew that it was different. And I know it is going to help so many people. And therefore, we want to make sure we get this out, not only to the people listening today who may be struggling on their own, but we also want to get this out to the workers' comp community so that our employers can help their employees, so that the workers' comp system have people who self-medicate. And this is an avenue that they can utilize to help their people become sober. So Dr. Wilson, thank you so much for joining us today. And can you start by telling our audience about your credentials and where you started? Because it is so impressive what you've done for the opioid world, and you're moving it into alcoholism.
Sure. Thank you so much, Diane, for that great introduction. And it's a pleasure to be on with both you and Leslie. Thank you so much for inviting me. Well, my background, I'm an internal medicine physician, and I am also board certified in addiction. I'd been working in a hospital setting, in a community hospital, for about a decade when the opioid use epidemic was really taking off in the late 2000s, 2008, 2009. And I really saw the impact on my own community. And so I decided to found a company called Clean Slate. And Clean Slate was the very first of companies providing opioid use disorder care specifically in an office setting, really just focused on doing that only and doing that very well. We were inundated with patients. We had 500 patients in the first 3 months. And it just grew very, very quickly from there. There was such a huge need, and we were trying to bring care to the people who were underserved. We were the first company to dedicate our care predominantly to Medicaid recipients. So the company grew very quickly. It has now cared for more people with opioid use disorder than any one single company in the country, with over 110,000 patients that have been treated now. There are 83 centers across the country in 15 different states, and they're still growing. And we learned an awful lot providing that care over those years. By about 2014, we'd cared for about 40,000 patients. And so I hired a researcher, statistician, data scientist, her name's Dr. Lisa Scheido, to work with me to build a not-for-profit. And our not-for-profit is called the Addiction Research and Education Foundation. We've done a lot of great work with that foundation. We actually have published several peer-reviewed journal articles that have impacted care nationally. In addition, we've partnered with Columbia University, where we continue to do research. We've partnered with other large organizations like Pear Therapeutics. It's a digital therapeutics company. So that foundation is alive and well and continuing to get grants and to grow. In 2017, Dr. Scheido and I realized, sitting again on all of that data, learning about what makes an improvement in patient care, we really learned that the longer you can retain people engaged in support and in treatment, the better that they do. So we thought, well, telehealth might really help people to both get engaged, but also to stay engaged in treatment. So we started another company called Boulder Care. Boulder was founded in 2017 and was the very first telehealth treatment program for opioid use disorder. Boulder Care has continued to grow. It's founded in the Pacific Northwest and has provided care to many, many thousands of people as well. And in 2020, Dr. Scheider and I looked at what was happening after COVID, realized that, quite frankly, the alcohol epidemic was surging. There was over a 50% increase in alcohol sales at the onset of COVID, which has continued. And we realized that was already an epidemic that was undertreated and not really recognized, not really noticed. The opioid epidemic was getting a lot of attention, as it should, but alcohol was not getting any attention. So we decided to put 2 years of research and our focus on how could we build a company that uses medical science to address how we deliver alcohol use care in a way that's meaningful, accessible, that can be done in the home, and that actually works. So we'll talk about that program, and I can, walk you through how it works and what we do, and love to take any questions that you have as well.
Wowee, that's a lot. You're doing a lot. You must be tired.
Yes.
It sounds like a labor of love.
I have my moments.
I love the fact that you were already ahead of the game in 2017 with telehealth, because I was thinking when, medical offices were closed and whatnot, and people were, trying to get access to care, that's a lot of internet necessity, and telehealth became a thing, and it's a thing now for us. So it's wonderful that you had that already in place, because I'm sure that people were hungry for it when they were feeling the depression of being locked inside their home, looking at the possibility of a bottle or of alcohol or a bottle of pills or whatever it was. So wow, that's excellent.
And alcohol was so affordable during the pandemic because people had nothing else to spend their money on, right? They go to the grocery store and they go and buy these things to use. Easy to sit in front of your TV set with a bottle. I also think it's really interesting because the fact that you treated both not only opioids, but also alcoholism, because these are two things that really work hand in hand. So many people are double addicted, and it's great that you understand where this stems from on both sides and what can truly help them in their recovery.
Yeah, thank you. There was a huge pivot right around the time that I started Clean Slate, where people were beginning to realize that medication treatment for opioid use disorder could have a profound impact on outcomes. Prior to that time, people were largely still going to detox or going to rehab for opioids. Occasionally, people would go to methadone treatment, and methadone treatment does work, but it really wasn't for everyone and wasn't possible for many because they had to go every single day in person to get their treatment. So that was a huge barrier. So the development of a single medication called buprenorphine, also known as Suboxone, changed the game. It enabled people to get treatment from home. And that's what we capitalized on with Clean Slate. Let's get treatment accessible, right? Make it possible for people to get treatment easily and remove those barriers. And we tried to remove even more barriers by making it with telehealth, with Boulder Care. So with alcohol use disorder, the pivot here is really to mimic what we did at Clean Slate. Let's try to bring science to this program, to this treatment. Let's try to make use of the medications, the nutrients, the different therapies that have been studied, and figure out how to really radically improve the lives of people who struggle with alcohol use. I think there were millions and millions of people who, would have a glass or two of wine at night, but through COVID, that became a box of wine a night. And a lot of the number one group that had the highest incidence of increase in alcohol use turning into alcohol use disorder were women with young children. If women with children under the age of 5, that rate increased 323%. That was above minorities, above every other group. So that's a particular passion of mine and Dr. Shido's, my co-founder. We really care about that. We've actually hired moms with young children to be the people who are providing peer support to our patients because so many of them have that struggle. So it is a real passion for us to actually revamp and reimagine how this care can be delivered in a way that's accessible, but that actually is effective. So I'm happy to tell you about how that all works. If you'd like, I can pull up the slides. It's up to you.
Yes. Yeah, that'd be great. As a child of an alcoholic, my mother was an alcoholic. I can really appreciate the way that you're changing the mother's lives for the children because it has such an impact on who we are and who we become. So we are looking forward to your presentation. I cannot wait for people to hear about your supplements. I mean, I think that's so amazing how you have support with that. When we're looking at other programs, and all programs are excellent, they help somebody some way. But I just love all of the different components you have in your program and can't wait for the audience to hear it.
Great. Well, thank you for saying that. I'm excited to share this. We have a patient that's in our program right now, actually, Diane, who would have been separated from her baby, most definitely, and might not have kept custody of her infant, who's less than a year old, if she wasn't engaged in our treatment. So for sure, this keeps moms and babies together, which is really important. So I'll start by talking about, what did we decide to tackle first? What were the first opportunities that we saw that we could improve what alcohol treatment looks like? And so most people are pretty familiar. I'm going to focus in on rehab. Most people are pretty familiar with the rehab model, right? That it's remote, generally you're going somewhere to have that care. You don't stay at home for it. It's typically 30 days. It can be up to 90 days, but the vast majority are 30 days. It can be anywhere from $30,000 to $80,000 out of pocket for a person. Insurance can pay some of it. Often it only pays 60% of it. So people are having to come up with $10,000, $15,000 or more on their own to pay for that care. It's largely non-medical. I mean, very few patients get any medication at all. Less than 0.4% of people who get treatment get any medication. So really what's happening at rehab is 12-step. People are doing, the steps, the Alcohol Anonymous steps, and there is certainly benefit to that, and we'll talk about that. But largely, this is a completely kind of social support structure with some counseling, and really the abstinence is sort of enforced because you're away at a place where you can't have access to alcohol. So people are just essentially abruptly stopped from using alcohol. It turns out that, unfortunately, they have a 13% success rate in the literature. And so, if you go to rehab, I've heard this from so many people, one of the very first things they tell you is if you look around the room, pretty much all of you are going to fail. It's one of the very first things they tell you when you get into treatment, which I think is horrible. I want to tell every patient that comes to us, you can succeed and we can help you do it.
So, doctor, my son has been in treatment several times,
Yeah,
and every single time, and every clinic that he's gone to, they have told him you will fail at least 7 times before you're successful.
that's right.
And that upsets, of course, the parents, because you're kind of giving permission to
Yeah,
fail, right? Well, everybody's going to fail at least 7 times.
yeah.
So it's just crushing when you hear them say something like that. So it's wonderful to hear that your program is not telling people it's okay to fail. You're giving solutions to be successful.
Yeah, thank you. Right. And we actually know that if people do each of the components of the program, they actually will be successful. It's all about engagement. And we'll talk about how that works. But so, we want people to not have to leave their family, leave their home, leave their children to get that care. So our program is completely at home. It's actually a year long, not a month. As you all know, you really can't heal from depression or anxiety or any other mental health issue, and you can't heal from addiction in a month either. So our program is a minimum of 12 months, forgive me. It is less than half the cost of this treatment program. We are taking insurance. It is evidence-based, so this is an entire medical program, and we're going to talk about that. And we have an 86% success rate, actually. So we are 600% better than the standard of care today. We both help people who are really committed to abstinence. About 3/4 of our patients choose abstinence. We also can help people who are earlier in the disease process who really just want to get control over their drinking back again. So we can help them learn to moderate their drinking, and we have many patients we've been very successful at doing that with. And now, of course, you can stay with your family, continue going to work, and that's one of the reasons why I like approaching workers' comp about this. Let's keep people employed and keep them continuing to work while they're in treatment, and have that treatment get them through the hard times throughout that whole year. So there are many different components of our program. Each of these are based on science. We picked every piece of this because we knew that it would have an impact on patient outcomes. I'm going to just talk very briefly about the fact that, again, while opioid use disorder gets a lot of press, and it should, it's hugely important and unfortunately growing, alcohol use disorder is actually 10 times worse. There are 10 times as many people with this problem. It's nearly 10% of the country has alcohol use disorder, would meet the diagnostic criteria for it. 1 in 3 people in their lifetime will get this problem. 1 in 3.
Yes.
So it is an alarming problem. It is massive. It's an epidemic of its own in our country, and it really needs attention. If all of these little guys were people with addiction, the yellow people here would be people with opioid addiction. All of the rest of these little people here are all with alcohol. So it just gives you a perspective on how much worse the alcohol situation is. On the bottom here in green are the very few who get any treatment. This includes going to AA, going to rehab, going to detox. It also includes if you happen to go to your primary care doctor. It includes if you went to jail, they counted that as treatment. So to me, all of those things should not necessarily count as treatment, but that's what they counted as treatment. So you can see how many are getting literally nothing. And then that one little red guy down in the bottom, he or she is the only person who got any medication for this disorder. So no one's getting medication.
Doctor, do you think the reason why the alcohol use disorder is so huge is that maybe it's more socially acceptable? Like, oh, I just have glasses of wine versus, oh, I like to take, oxycodone. Does that play, like, the social kind of piece of it? Does that play into it?
I think it's 2 main factors. Yes, it plays a huge piece of it. It turns out that we now know that genetics are a stronger driver of developing alcohol use problems than any other thing. If you look at genetics, it actually, if you have twins that were born who were reared apart, if one of the twins lives in a family that has no alcohol at all, they're still much more likely to develop alcoholism than their siblings are in the same family because of that genetic input. So if you have a genetic, risk, and that increases your chances to 50, maybe 60% of getting this problem. But now most of the country is exposed to alcohol on a regular basis. You can imagine that 1/3 of people in the country eventually are going to struggle with alcohol in some way. And that's what happens. So it's largely the prevalence and the acceptance of it, and it's also the genetics. And it is, unfortunately, widely prevalent that people have a genetic predisposition to this disorder. And yet nobody's checking genetics. It's one of the first things we started doing, is looking at how could we use genetics to help us diagnose and treat this problem, and to help families know, like Diane's, that, your children are at risk. We can check the genetics of our patients' children and tell them, your son has a real risk here, and how can we help you prevent him or her from developing that problem? So I'm going to just focus in on the overall success rates of what's out there today. AA, unfortunately, is only 8% successful. That's not very well known. It certainly has helped millions of people. I want to give it absolute credit for who it helps. And I think it's great that it helps those people. It's the 92% of people that it's not helping that I'm worried about. And I think that it's important for us to look at many ways, all the different possible ways people can arrive at a healthy life. Detox works less than 10% of the time. And as you said, Diane, people who are going to rehab typically go 5.1 times. So it's incredibly common. Right now the cost is really high and the stays are really short. Our goal was to make the stay much longer for considerably less cost than the average program. I think I'm going to pivot into the brain health now, because I think this is a fascinating piece and helps people to understand why taking a medical approach to this makes so much sense. So this picture is what's called a PET CAT scan. It sort of shows the activity of your brain. And if you look at this, it actually shows what a normal healthy brain looks like, hopefully what all of our brains are firing like right now. It shows that, the frontal lobes are very active, you're thinking clearly, you're making use of all the different parts. When someone abruptly stops alcohol, so picture that they just got into detox, and came out a few days ago, or they're just about a week and a half into rehab, this is what their brain looks like at that time. Alcohol causes the brain to basically dump all of its neurotransmitters. And so the brain's basically on empty. And people also have a significant nutritional deficiency. There's a wasting syndrome that happens when people are drinking all the time. I mean, alcohol is a solvent, right? So it effectively kills a lot of the healthy bacteria in our gut, and we can't absorb nutrients and we can't absorb vitamins that we need to. So with all of these nutrition problems, the brain is very shut down. But we're asking people in rehab to learn life skills. And this part of the brain, the frontal lobe, is where learning happens. And yet the brain in the frontal lobes is completely shut down. And if you look at it even 100 days later, it's still only firing at about 20-25%. So no wonder people struggle and are craving alcohol, because alcohol is the only thing that kicks their brain back into activity again. They feel foggy, they feel really unclear. So that's why our nutrient program was designed to address that. We took a deep dive into the literature, my co-founder and I, and we actually read over 2,000 peer-reviewed journal articles. We reviewed every single paper that has been published since the year 2000 on alcohol use, and we found several really important things. We found that there are actually 30 different medications that can help alcohol use, that have great evidence and that can be used based on people's genetics. So we can use a genetic profile of a patient. And if God forbid one of your family members had cancer, what you would do is take them to an oncologist. One of the first things they would do is get genetics, right? They get a genetic assessment. So that's what we do. We get a full genetic assessment on every patient. It tells us, number one, why did they develop alcohol use disorder in the first place? And number two, how's the best way to treat it? What's the medication or group of medications that are going to be most effective for that patient? It also tells us about the nutrients. So we read a lot and learned that, again, the brain is so deficient in nutrients that there are several key nutrients that we can put patients on to dramatically improve brain health. Literally within 2 weeks, when our patients start our program and they've been on the nutrients that long, they tell us things like, I can think clearer. I had a young man, 27 years old, in our program. He said, I haven't been able to read a book in 3 years because I couldn't remember the last chapter. And after 2 weeks on the nutrients, he was able to read several books in one weekend because his brain function had just returned so strongly. So genetics helps us to know how to replete those nutrients, how to replace them for patients. Certain people can't absorb B12, for example. They need shots. Certain people have other absorption problems. So it's telling us not just what the problem is, but how best to treat the problem.
Doctor, let me ask a question. If they didn't go on supplements,
Yeah.
because This is not something that's common.
Yeah.
How long does it take the brain to normalize, or will it ever normalize again?
Years. Yeah, in fact, with Clean Slate, the data showed us that people typically needed to be in treatment for an average of 3.1 years to be 91% successful in opioid treatment. So we know that it takes years for the brain to actually restore its health. And what we're finding is we can condense that down to months, where people are actually thinking more clearly, they sleep normally, they are not anxious, they're not as agitated. It's a dramatic improvement just by using these. And there are actually 20 different nutrients that we put patients on.
Are there cases where there's permanent brain damage and that supplements, without supplements? And then if somebody does have permanent brain damage, how does the supplements help?
Well, advanced cases of people with severe alcohol use disorder can develop what's called an alcoholic dementia, right? And that happens in large part because of B12 deficiency. B12 deficiency causes an alcohol encephalopathy. Oddly, the only time people get B12 who are known to have alcohol use problems is when they land in the hospital. They'll get a bag of IV fluid that has B12 in it. They're generally not discharged home on B12. They're not told to take B12. Nobody follows alcohol use disorder patients and says, let's make sure we take care of your B12. And yet that one nutrient, never mind the other 20, can cause alcohol-related dementia. It generally happens late stage. People have usually been drinking for many, many years daily before that happens. Unfortunately, it is irreversible if you've gotten to a certain stage. But there is a way earlier on, when the deficiency is there, but they haven't caused permanent damage, where you can restore brain health. And generally speaking, the people who are going to rehab today aren't at that point. By the time you've developed dementia, you're in a place where it's much harder to just navigate your life. You're not in a place where nutrients probably would have been able to turn that course yet. So the vast majority of people who are out there are benefiting and can benefit from these nutrient therapies. And that's why we're so aggressive with them. And B12 is just one of the 20, that we use.
Can I go to the genetics piece?
Please.
So can you take a test or something that shows, yes, you have this gene that gives you propensity to alcoholism or alcohol use disorder?
You can, yeah.
Are you serious?
Yeah. There are several genes that help us to know, what the risk factor is for developing alcohol use disorder. Absolutely. And so we found a lab that does this totally privately. We can send the genetic material, which is just a swab, to the lab, and the patient's identification information is not given to the lab. So this is totally private. They're given a patient ID number. They send back the genetic information to us. We know the patient's ID number and to match it with the patient. And then they delete the genetic information on their side. We're the only ones who have it, and it's protected health information. So we're able to do all this testing and make sure that patients know that it's not like 23andMe. Their data is completely safe and protected.
Yeah.
So
they're not going to get any familial surprises or anything like that, calls from long distance.
Correct.
Or something.
Yeah. Nobody wants to get into alcohol treatment and find out they have 3 cousins they didn't know about.
Right. Yeah. Thank you.
So I think it's really important to know too that the genetics help us, again, picking the right treatment. So about 1/5 of people, I was telling you about B12 and alcohol related dementia, 1/5 of people can't even absorb B12 orally. They have to get it as an injection. You may know people who get B12 injections, right? So if we see that anomaly, if we see that genetic allele abnormality, we start right away with injectable B12. So all of these things are tools to help us know exactly precisely how to manage that particular patient's treatment. It's not one size fits all. It's totally customized treatment to each patient. So I'll talk a little bit more about the nutrient repletion part, because you had mentioned, Diane, that was of particular interest. And it really is something that I think makes North Star stand out, because no one else is addressing this huge problem. And yet there's abundant literature to support its use. There's actually abundant literature to support nutrient therapies in other addictions. So it's widely out there. It's just not being pursued, unfortunately. I'll just pick on one nutrient. We've talked actually about B12 quite a bit, so I'm going to talk about magnesium next. Magnesium is a great example of a single nutrient that can make a profound difference in how patients feel and how they do. When people drink alcohol, they actually start losing magnesium from their kidneys. It's just normal. Everyone who drinks, this starts happening. But you can imagine that if you've lost a lot of magnesium, it turns out that magnesium and alcohol have a similar effect on the brain. They're very relaxing on the brain. So now you think your magnesium levels are steadily dropping down. Next morning, your alcohol has worn off. So you don't have either the effect of magnesium calming the brain or of alcohol calming the brain. It causes people to feel anxious, sort of a creepy feeling, the very feelings of a hangover, that feeling of, wanting to have a drink again early in the next day, that actually comes from low magnesium levels. So by aggressively treating magnesium when patients start in our program, we diminish their anxiety. They start to sleep better. They're again thinking more clearly. Their cravings for alcohol go way down. It's profoundly impactful. One of the early things that can happen to people who are drinking a lot of alcohol is their magnesium levels drop so low that then their other electrolytes like potassium get affected, and they can end up with heart arrhythmias. So many people landing in the hospital with heart problems, it's actually alcohol related, and people don't know that. So just this one nutrient can avert a hospitalization where you're trying to address palpitations that you didn't realize were alcohol related in the first place. So these nutrients aren't just a small part of this treatment, they're actually a key part of restoring whole body health. So that's just one example.
That's super interesting, because in our last episode, Jake was trying to help us understand his addiction, right? And one of the things he said, it was so interesting to me. He was saying something like, well, when you're thirsty, your body tells you you need to drink water. When you're hungry, your body tells you you need to eat. When you're sleepy, you fall asleep. When you have an addiction, you need that thing.
Right.
Because it's like your body's giving you a message that you needed to satiate that situation.
Yeah.
So this is very interesting. I'm a nerd, so I like the medical side of things, but I like more natural methods that are like this. This is, a lot of this sounds so natural. Like this is how our body's working anyways. Why wouldn't we fulfill those needs if that's available to us?
Yeah, let's support that body. That's exactly right. I actually believe truly, and I think we will eventually be able to prove this and publish this, that there's a critical point where people have been drinking enough and for long enough, like the people who went from 1 drink of wine a night to 2, and then from 2 to a box every night. I think what is happening there is they get to a critical nutritional deficiency point, a critical point where so many nutrients are now so low, they can't not drink. It's exactly what you just said. They get to a point where drinking becomes a compulsion. And it's a compulsion because of the physiologic drive to drink. Just like your son Jake said, actually, he really hit it on the head. That's what happens. And so at that point, people are stuck. They don't know what to do. And most people aren't at the point where drinking a box of wine, they're about to lose their job yet, or their spouse is leaving them. So they don't get treatment, right? They don't go to rehab. They don't go to AA yet. They wait till it's really bad. And by that point, they're so depleted that they're drinking 20, 30 drinks a day.
Dr. Wilson, I have a question. There's a book we have in our house that we read, just to kind of help us understand where, like you said, it's, you think, oh, alcohol use disorder, somebody in the gutter with a bag wrapped, wine bottle wrapped in a bag. So there's this book called Almost Alcoholic. I don't know if you've ever heard of it.
Yeah.
And it was, I wanted to give it a brief mention just because it was very intriguing, the way that the authors described this kind of trajectory that gets full blown. Like you don't like, does this person have a problem or not, or what, so it gave a good insight to that. So I appreciate you talking about the difference between full blown and going from 1 glass to 2 glasses to now you're drinking the box of Franzia or whatever may meet your needs. So when do you know?
Yeah.
When do you know it's a problem?
It really, I think, is when there's just a compulsion that you can't stop, when it becomes that you're making a choice between someplace where you really prefer to be going. You usually would like to go for a walk in the evening, but instead you just reach for the wine. Or you typically would like to, go out with friends, and you're doing that less because you need to drink and you can't drink with them every time you go. You're making decisions that are impacting the way you live because you have to preferentially make sure that you have access to the alcohol that you need. There's kind of this, point where you really feel like when I start drinking one or two, I can't not drink three or four.
Right.
One or two isn't enough. It starts to become a bit of a compulsion. And I think that is that critical point. And it probably has to do with a collection of different nutrients getting to that certain critical place. And, we talk about alcohol use disorder at North Star about being numerous stages that, and again, I'll use cancer as an example. We all hope to catch breast cancer at stage 1, right? Because it's more treatable. The sooner you catch it, the better it is to treat, the easier it is to treat. So there's also stage 2, stage 3, and stage 4 alcohol use disorder, right? So when you get to stage 4 alcohol use disorder, generally things in your life have gotten really out of control. You've had a DUI, you might lose your job, your spouse might leave you, you can't parent, something big happened that made you think it's worth telling my boss that I'm going to have to go away for 30 days. You have to tell them, right? You have to tell your family, you have to tell your friends. I mean, people are going to know. So it becomes bad enough that they are like, I'll go for 30 days to get this treatment. And why do we wait till people are that bad? Why aren't we getting people at stage 2, stage 3, even stage 1 to try to help them avert getting there in that first place? And that's what North Star is trying to do. Not only can we help the folks who are stage 4, they don't have to go to rehab anymore to get this treatment. We actually can do this entire treatment at home now. But why not try to get people who are at that stage 2 or 3 where it's really slipped into a place where their life hasn't become dysfunctional yet, but a place where they've lost control to some degree and it's getting worse and not better?
Well, and I think, doctor, the reason we don't catch it until it's stage 4 is because there hasn't been a program like yours that is truly anonymous. And we're going to talk a little bit more about that, because Alcohol Anonymous isn't really, because you're in front of all the people, everybody sharing your story. And yes, we don't necessarily tell those stories or point people out, but in order to tell your story, you have to be comfortable to speak in front of so many people.
Right.
And your program allows them to do something different. And I can't wait for you to share that with our audience.
Yeah, I will do that now, actually. Thank you for bringing that up. I think I think anonymity was something that was of prime importance to us in building North Star, because of exactly what you said. So few people actually even go to Alcoholics Anonymous. I showed you that image of how few people get any treatment at all. AA was part of that treatment list. So clearly, less than 9% of people are even willing to go to AA, never mind rehab. And that's because of the anonymity. So we actually sought to have a completely new and innovative way of providing this treatment at home. I'm going to talk about our doctors and nurses and who's giving you this care, but I want to start out by talking about the anonymity of peer support at North Star. At North Star, we thought, well, peer support's clearly important. I mean, it makes a huge difference in how people do to be able to get advice from someone who's actually been there, who has lived experience with alcohol troubles. But to be able to do that perfectly anonymously gives the person total freedom. They can come in as an avatar when you're wearing a VR headset. That avatar enables you to be whoever you want to be. You can change your voice, you can change your color, you can change your gender. So no one in that space could possibly know who you are. You pick what your name is. It is the total ability to be anonymous that then enables people to say, I drank again last night. I had a rough time, and not worry about saying it, or to be able to ask questions and not have any apprehension. So it's just utter freedom. And it's so important for our patients to have that. And they really love this experience. We built this VR space. We have you see the space that's behind me. That's sort of what it looks like when you're sitting in the room. And it's incredibly realistic and a very authentic experience for patients. So we've really enjoyed this, and our patients really enjoy it. There are meetings all day long, 7 days a week. And we actually can now make groups, if you think about it, that are specific to a certain group of people. So for example, we can have veterans groups. We can have groups just for moms with young children. We can have groups for Native Americans, right? We can have groups specific to a group so that they not only feel like other people in that group get what they're going through from an alcohol perspective, but they also know about the struggles of their own personal lives because they have a similar personal life. So it's been remarkable to introduce this.
That is awesome for accountability. You build a group that people really begin to bond. They have like interest and life circumstances.
Yeah,
All of a sudden now they have people that they can depend on, share their story, and hold each other accountable. I think that's fantastic.
thank you.
Yeah, and I was gonna say, I've actually heard a couple times anecdotally, people that have gone to 12-step meetings and they're like, oh my God, I knew somebody that was in the meeting and I didn't even know they had a problem. And now they know I have a problem, and like felt a little embarrassed and maybe shy to go back. So this is definitely something that makes people ease into being more vulnerable and open to sharing without fear of judgment. Or even it could even be like you go into a meeting and you're sitting in a physical meeting, not a VR meeting, and
Yeah.
you maybe are having a day where you feel really fat or not beautiful or whatever, and you already got those hangups going on, but now you're going to talk about your addiction, and it's just it's that can create anxiety as it is. So this is really quite nice. And I mean, there's so
Help at
many
home. You know, you
options, it looks like.
exactly. You don't even have to leave your couch. You can, if you're traveling, you can take your headset with you. We've thought about this for people who drive for a living. Well, when they go from, state to state, they can bring a VR headset with them. I mean, this is portable group work and can happen from your couch and your slippers, to your point.
Well, I was also thinking, like, for the moms with kids, like for them, it's sometimes hard to even figure out a time to go grocery shopping, or, and maybe an older person, an elderly person, let's say, that doesn't really can't drive, or isn't willing. I don't know that they would be into my mother-in-law. I bet you she doesn't have an issue for need of this program, but she could figure out, she's 80, she could figure out how to use the VR. But it just seems like it opens up so many things. Some people don't even have a car to go to a meeting. So this is
Yeah.
very excellent.
And this is all sent to the patient in their home, by the way. They do not have to own a VR headset. We send all of this to them in their home in a kit, actually. So I'm going to show you that next, actually, because I think that's kind of important. When people want to start up with our program, all that they have to do, because you don't have to go anywhere now, right? All you have to do is either call or put your information into our website. Immediately you can have a consult with a nurse and talk to someone and say, is my problem significant enough that I would be benefiting from treatment? We can give them that guidance and that consult and help them feel comfortable and know whether this is the right program for them. But then we can overnight a kit to them. And I'm going to show you what comes in that kit. Everybody, if they don't already have a tablet, they'll need one, because that's how we do our telehealth visits, right? Every patient is being seen by a doctor, a nurse, they have a nurse practitioner, they have a navigator, someone to help them sort of navigate the healthcare system. And they also have a peer guide, their very own peer guide, who's there to give them, social support for what they're going through. And they can meet with them one-on-one in addition to the groups. So we provide a tablet to people who don't have one so that they can do their telehealth meetings that way. We also provide the VR headset, as I said, and we have people that help them on board to that. And we've made it so easy that you literally put on the VR headset after you've tapped a button on our app in the phone, and you're in your group. So people don't have any learning curve with needing to use the VR, because we've made it as simple as it possibly could be. What group do I want to be in? You scroll on your phone, you pick that group, you hit join, put on your headset, you're in. So it couldn't be simpler. We also send people, blood pressure cuff, monitoring tools that help us keep people safe at home. We give them the DNA testing kit. That cost of the DNA testing is included. And then we also send them drink substitutions. This is something that, I shared with Diane when we were in Vegas that has been incredibly impactful, helping people to stop drinking. If you think about it, many people have this experience of a ritual, right? They come home from work, they make a martini. They come home from work, they get that glass of wine. And, losing that ritual actually is another loss of dopamine, another loss of reward hormone in the brain. So if you can keep the ritual, but just lose the alcohol, it actually helps the person to cope. It's very much like fake cigarettes were used years ago. It's a way to give your brain a little bit of something without the addictive substance. So we have people transition from their alcohol, we taper them off of their alcohol of choice onto a substitute non-alcoholic beverage. And we have a whole selection. We've tasted a bunch of them. We know the best ones. So if someone is a whiskey drinker, we use this one particular fake whiskey that tastes identical to the real thing, and they taper off of their usual alcohol and onto this. We have patients who bring it with them. They brought them with them to Christmas or to New Year's events. They literally bring their non-alcoholic drinks with them to events now so that they can maintain their sobriety in those difficult events and still be able to participate socially in an event with their peers or with their family and loved ones. They're not now separated by always being the one with a Diet Coke in their hands. They get to have, a drink in a glass, and it matters. It actually really matters. So people have been so successful with that. And then last but not least, we send them the nutrients. In that box are 3 months of nutrients. And we send them to everybody out of the gate because we know what the impact is on their brain function. And we want people to be sure that they're going to take them. And we send them a pill sorter and everything. We help them fill it all out. So we couldn't make this simpler to be able to, get launched in treatment successfully. We're really meeting a gap. If you think about it, right? We're meeting a gap between support groups in your community, or, some people use sober apps where it might help you count how many drinks you've had that day or that week. To my thinking, neither an app nor a support group by itself is technically a treatment. We use support groups in cancer treatment, for example. I think support groups have huge value, but they're not the treatment for the cancer. They're just a support for how you get through your treatment, for that disease, right? So on one side, we have something that's really not enough for most people, and most certainly not anonymous. On the other side, we have something that's not feasible for most people. Going away to rehab is just simply not feasible for most. So we need to have something in between that can be done at home through telehealth, that can be done with complete support from all of your medical team, and that can be done completely anonymously in VR and still get that support that people love and need. So that's what we've developed, is a very comprehensive program that provides all of that support while having completely medical guidance for an entire year. And the results have been amazing. When people consistently take the meds, take the nutrients, participate in VR, and meet with our providers, they are literally between 86 and 100% of the time successful.
That's excellent. We talked about the problems with, like a meeting where you go in person, but now on the flip side, I'm thinking about the rehab piece of it. And like you mentioned, people not being able to leave their work or their home for 30 days or 60 days or 90 days. But then there's this other piece I was thinking of. I shared when my daughter was in the mental health hospital and going through her treatment. There came a point where she had a choice, like to stay a little bit longer or be discharged. That she wanted to stay. She's like, I want to stay in here. She felt safe. It wasn't the real world for her. And so I can imagine with rehab, there's a parallel there, that it's kind of like, well, yeah, the first, week or two, you're probably like a buck and bronco, not wanting to be part of whatever, if you're really suffering, coming, through your, out of, your main, I don't know what you would call it when you're
really coming out of your detox.
Yeah. So and then you get into this rhythm in rehab, and then now all of a sudden that rug is going to be pulled out from under you. And I'm sure people are afraid to go back home and back to the real world because of what they're facing. It's kind of a challenge. So with your program, it sounds like people are still in the real world and still like going through treatment and facing the day-to-day things that we all face, stressors and whatnot, but able to kind of help them be able to look at it from a a perspective that this is life. This is a long-term, this is life. This is the rest of your life. This is how you're going to do life.
I think one of the things, I'm sorry.
No, go ahead.
I think one of the things that Leslie and I always want to provide to our listeners is to diminish the stigma. And I think that's what your program does. It diminishes the stigma because people are able to do that at home. I told that story in the beginning about my son and you know, holding on to a 200-pound person from the front seat to the back seat with the door open and closing and opening and closing and the yelling and screaming and the person on the Bluetooth, you know, talking to us at the same time. I mean, it just was so chaotic. Yeah. Had I had been able to say to my son, I want you to do this program from home, you know, you will still be able to drink because we're going to curb you
down
slightly. So your program, it's something, if you drink 12 drinks a day, you would have 11 real drinks one day and one fake one, right? And then we would go through and work our way down to taper. And I just think it would have been so much easier to get him to agree to that program because he wouldn't have felt like he's being locked up and that, you know, he's being punished. The only reason my son went through treatment is the doctor told him, look, you got 8 drinks in you before you die. You put your bottle in the back of your car and you go home and you kiss your mama goodbye because your mama deserves that. And he did exactly that. He took the doctor's advice, but chose to, at that point, become sober. And, you know, it was really, really hard for him. But I think that with your program, your supplements, your train, you know, all your trained personnel that can help him, the genetics testing, I think, you know, to be able to say to him, look, this is why, this is, and you're not a bad person. This is just what happens. My son is adopted. And he did have genetic testing done later and found out that he has alcoholism and drug abuse on both sides of his family. So this is something that he's going to battle his whole life. But with a program like yours, I think it would have been so much easier for him.
Yeah, he doesn't then have to become immediately, but without his wish, vulnerable either. You know, he doesn't have to suddenly be exposed to a lot of people that he doesn't want to meet or doesn't want them to know he's, you know, he's who he is and he's there. It's very vulnerable making. And I think to the point that you were making earlier, you know, to Leslie, they come out and what happens on day 31, you know, it is an artificial environment that they're in when they're in rehab. And when they suddenly come home, they're back to all of the stressors that they always had. Their job is right back. All of the people that they love are looking at them like, are you going to make it? Are you going to fail? You know, so you're kind of being stared at, you know, will you succeed? Are you strong enough to do this? So there's a lot of pressure. And on top of that, you know where your liquor store was that you always went. You know where, you know, you used to keep the liquor in your household. Other people in your family may still drink, so you're still being exposed to it. I mean, all of these things basically are kind of around you, and you don't have the support at that point to be able to resist it generally. And going to a meeting can be difficult to do every day or to do at the moment when you're really craving. So I think that having access to virtual care, we're there for these, you know, for our patients at 11 o'clock at night, you know, on Saturday morning. I mean, we're just there, and it makes a huge difference to be there for them when they need you. You know.
Excellent. What kind of support does your program have for loved ones?
Yeah.
Do you engage in that, or how? Because that for me was, and I too have 2 parents that are alcoholics. The hardest part is kind of trying to figure out how to draw boundaries with them. And I know that word's used a lot, but also like what resources to send their way. My dad was doing stuff with the VA, and that just did not seem effective. It seemed like a lot of people that really were suffering from like PTSD, but also alcohol use disorder and opioid use. And so I just didn't even know how to help him or where to draw the line with him or anything like that. So what do you have? What can you tell the families or the loved ones of people suffering?
Yeah, we knew that was so critical to this treatment that we actually built what we call our ally and family support program. So we call it an ally. We ask every patient to pick an ally. We call them the ally because it should be the one human that they know, no matter what, will be there for them. That could be their spouse, that could be their sibling, that could be a child, that could be, an aunt or a best friend. We want the patient to pick that one human that through this whole course of treatment is going to stand by their side, and that we can reach out to and say, we're really worried about how Joey's doing. Can you reach out to him too? We want to make sure he's okay. But at the same time, we want to provide support to that ally and to the patient's family. The patient's family, as you just pointed out, they're lost. They might be really confused by why are they suddenly on all these nutrients? Why are we asking them to still drink a little bit and then taper down? All of these things might be confusing, so they need education about that. We want to help them understand what the brain looks like in someone who's stopping alcohol, so they can understand some of the things that have been going on and how hard the struggle has been and what happens when your brain loses all those nutrients. It can just rekindle the compassion that all of us feel when one of our loved ones develops cancer. We have so much compassion. This is also a medical illness, and we have to help our patients' families know this is a medical illness. They have a genetic thing that caused them to have this. It's horribly sad that they have this problem, but they're not weak. They are good humans, and we can help them get back to who they were. And you can help us help them in these ways. So education, supporting them, and we also have VR group meetings just for them. So they can they can use the headset of their family, of the person that's our patient, right? They can use that same headset and join a family VR group meeting to be able to meet with other family members who are also dealing with supporting their loved one. So we really knew that was a key and important thing. And we hired a person who themselves have lived experience being an ally, being a family member, a spouse to someone who had alcohol use disorder.
Interesting.
Yeah.
I have to say, when you talk about the cancer component and liking it too, there were times when my husband and I were so exhausted of living with this issue. And, when we likened it to cancer, we said, if he had cancer, if he had leukemia, if he had something else that was medical, everybody acceptable, so to speak, you can't do anything about getting cancer.
Yeah.
Then all of a sudden we were able to look at our son slightly different and be more compassionate and really be able to provide more help for him in a way that we were able to understand this is not something that he created on his own. This is something that happened to him, like any other illness will happen to someone. And it was so much better for us to be able to say, all right, we're liking this cancer. We now can take a breath and then go forward, because before that we were just so exhausted.
Yeah, I mean, families are so depleted, right? And they're also embarrassed. There's stigma to them. If your son got cancer, your neighbor might bring you baked ziti. Like who's bringing you a meal because your poor son is struggling with alcohol use disorder? They don't. So even families are embarrassed and suffer from that same, stigma that's so wide and prevalent. So we have to help. A part of North Star's mission is at scale nationally. We need to be educating people that this is a medical illness, that they suffer from a medical illness, that it turns out 10% of the country is suffering from. It's a very serious illness. It's progressive, just like cancer would be without treatment, and people deserve treatment and can get that, and it works. And I think that this is an important message so that people stop looking at people as they're weak. They are morally inept. They just don't care. They don't care about their family because it's anything but that. They still care. They're just not getting treatment that works, and they're struggling, and their disease is progressing, and everyone's mad at them for it. And it's just a sad thing for the families as much as for the patient.
Yeah.
Yeah.
Well, I think you've given us a lot to think about. I appreciate it. And I don't know if Diane has any closing comments.
I
Diane?
think I just want to urge anyone that's in this situation, whether it's themselves, a loved one, to explore the North Star program. I know firsthand what it's like to live with somebody that has an addiction to alcohol and opioids, and it's not, as you know, fun. So this is a way I think that we can help people not have the stigma, not have the shame, but give them real opportunity to become healthy again. Doctor, your program is outstanding. Thank you for all that you do in the medical community.
Thank you. Thank you for having me on this. I really appreciate that. If anyone is interested in learning more about the program, northstarcare.com. And I really appreciate your time and your great questions. It's been a real pleasure to meet with you. You're a hero, Mom. You are. It's wonderful.
Well, thank you so much. And I wanted to point out that we started this podcast to provide hope to people. And when we talk about people going to rehab or treatment, being told they're going to fail 5, 6 times, that they're left hopeless. And here we've given you a message of hope today, some options. We want this to be useful and helpful and resourceful to you as a medium to our community. We have a big workers' comp community that Diane and I are part of, but we also have a huge social community that hearing the statistics you provided tell us that whoever is listening to this today, there's going to be at least a handful of people that are going to find something useful from our message today. So I do want to thank you. I want to encourage people to keep talking, to keep listening to those around you when it comes to these issues, and just look for help. It's out there, and we know that we've given you some ideas, but you may have some for us. So we encourage you to reach out to us as well. Diane and I are always taking suggestions for useful, resources in this struggle, and we'll be talking about other struggles as we continue to create content, but with mental health issues and alcohol or any substance abuse or substance disorder issues. So with that, I'm going to close out. I want to remind everyone to be kind to themselves, be kind to others, and sprinkle it everywhere like glitter. Thank you for joining us.
Thank you very much.
Bye-bye now.